What is sexsomnia? As sleepwalking is identified as parasomnia, sexsomnia, which is similar, brings about sexual activity while dozing that can obscure sleep. It is a kind of sleep that causes individuals to participate in sexual acts during periods of rest. It often leads to lack of sleep due to obscuring slumber, resulting in disorders that can adversely affect human health. On the off chance that you have ever carried on sexually while dozing, you're not the only one. There has been a more critical investigation into this uncommon and to a great extent obscure sleep issue known as sexsomnia. Most people know about sleepwalking, in which a person during profound rest will get up and start strolling around. Another condition that happens amid a similar period of the rest cycle is sexsomnia, in which the dozing person carries on sexually. No different than sleepwalking, sexsomnia is in large part unclear and misjudged. Like sleepwalking, sexsomnia is known as irregular movements and activity that happen amid a particular sort of rest. Be that as it may, not at all like different types of parasomnia, the condition can be sexually forceful in nature. Sleep sex or sexsomnia is a type of non-quick eye development, NREM, parasomnia, similar to sleepwalking, which causes individuals to participate in sexual acts, for example, masturbation, caressing, intercourse, and possibly, unintentional assault while they are snoozing. This is like sleepwalking in that it happens amid NREM rest, yet therapeutically it is a different condition. What causes sexsomnia? Numerous parasomnias, including sexsomnia, may or may not be inherited. Consequently, specialists aren't precisely certain what caused them. In any case, there are plainly some matters to consider that make sexsomnia more prone to happen in a few people than in others. A considerable number of these behaviors amid rest happen along with other issue, for example, lack of sleep or obstructive sleep apnea. Also, certain pharmaceuticals can activate these sorts of practices. There likewise is by all accounts a hereditary part to NREM sleep parasomnias, normally going through families. As per the information from the Toronto Western Healing Facility, men will probably encounter sleep sex more than women, however, it can happen to either gender. Specialists at the facility likewise trust sexsomnia may be more usual than most individuals are aware of. There is a degree of shame that goes along with the confusion associated with this disorder, so it is commonly underreported publicly in many places. How sexsomnia can benefit from outside assistance. Right now, there are no FDA-endorsed drugs for the treatment of sexsomnia, yet specialists have had successes utilizing some regular narcotics and antidepressants for treating the condition. On the off chance that these prescriptions are used, it is necessary to screen and monitor the patient for a couple of months to ensure they are working. Another essential way to deal with treating sexsomnia is making a sheltered area for those influenced by the condition. This may incorporate resting in a different room, locking entryways, or notwithstanding setting up ways to wake individuals and make them mindful of what is going on. It is critical that measures be set up quickly to keep both the individual and any other people in the house safe. At last, be aware that a fundamental rest issue, medication or the overuse of liquor may possibly bring about the sexsomnia. It's critical to seek treatment for those conditions, as well. Ensuring patients are getting a sufficient amount of rest, keeping away from specific medicines, and treating any fundamental issues, for example, drug abuse, alcoholism or emotional, or mental pressures might be the primary course of treatment required to make this type of behavior go away. Sexsomnia can be risky for daily life. You've known about sleepwalking, night fear and potentially even individuals who have sleep-related dietary problems, yet you may have never known about sexsomnia, a condition that causes individuals to take part in sexual exercises, going from making sexual clamors to pelvic pushing to masturbation to sex while they're snoozing. The condition, which falls under the shadow of parasomnia, or matters that cause irregular or abnormal conduct of the sensory system amid rest, it is still moderately obscure to the overall population. However, it is presently being examined by therapeutic specialists and specialists with an end goal to understand more why it happens and how to treat it. Sexsomnia, for a few people, can be experienced as a bizarre or maybe irritating occasion, and in rarer, more extraordinary cases, it can be the reason for rape or attack, which can leave individuals and others involved disturbed and confused by the behavior. End of article.